Face masks are now part of our daily outfit, and while wearing one is important for public health and our own safety, in a lot of places it's mandatory, for some of us, it's the root cause of an entirely new problem that's being called mascne. That's acne related to your mask. To tell us more about it and how to prevent it, we have Dr. Morvarid Hessami, who's joining us this morning. Welcome to Your Morning.
Good morning, Anne-Marie. Yes, mascne is now a new, basically, term coined in the last few months. However, it's not a new concept. We've seen it before in athletes under their helmets, chin guards. We've seen it in women wearing hijab, in men wearing turbans, under the work helmets, and so on. However, it is like simply a skin breakout under the mask. And there are multifactorial causes. For example, excessive sweating, heat, humidity, overgrowth of bacteria, production of oil, friction, contact dermatitis, but also stress and diet plays a huge role. I don't want to simplify that it's just acne, because I've seen other conditions under the mask, sometimes contact dermatitis, bacterial infections, cold sores, and sometimes even complicated skin problems.
All of that sounds like nothing we want on our face. So, Doctor, you have a few do's and don'ts to help prevent mascne. Let's start with the don'ts.
I know it sounds silly, but, we all do. So don't use foundation, makeup, lipstick, anything sticky, oily under the mask. Try to reuse, if you want to reuse your fabric mask, wash it before. Try after a few hours of using your disposable mask, when it's humid, wet, and damp, try to change it. I know we do long hours of shifts. In healthcare profession, we used to wear masks just for a few minutes. Now we are using for longer hours, so it causes more problems.
Yeah, and more people are using them, not just healthcare professionals anymore. We're about to see teachers enter the classroom using them as well. Let's give everybody some of the do's. You listed one already, which is make sure that you're washing your mask if you're wearing a reusable cloth mask. Tell us, what do we do when we need to apply moisturizer? Winter is coming, or even things like sunscreen.
It's a very good question. I just simply say, wash your face with water. Use a gentle face cleanser. Try not to use very harsh washcloths, scrubs, just use your finger to wash your face, and use a mild moisturizer after. If you are wearing your mask after, try to apply it about 15 to 30 minutes after using your moisturizer or sunscreen. But if your skin is still very dry, chapped, cracked, at night, maybe you need to use a stronger or more, barrier creams at night. And if problem persists, show to your doctor, you may need medicated creams.
There is an area of irritation for a lot of people too, bridge of the nose and behind the ears. What can we do about that?
That's a very good question. We used to call mascne acne mechanica, because there's also mechanic problems and friction causing some of these issues. So what I suggest is make sure that your mask is fit, it's right. So too tight or too loose may cause problem. However, the reality is, with long hours of using this strap behind our ears, and sometimes we have, for me doing procedure, I use N95, I use a facial, surgical mask on top. I have my glasses. So all this friction causes more problem. So, and there are behind the ears, there are areas that sometimes we have already dermatitis, psoriasis, and that may increase the problem. I've seen in our nurses in hospital, they do innovative things, like they put a button in a hairband and they try to put a strap around it.
Dr. Hessami, good to have you on Your Morning. This is important as we are heading back to school, a lot of people heading back to work, where they're going to be needing to wear masks for long periods of time. Thanks so much.
Thank you very much. Thanks for having me.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.